Hi, this is the continuation of a series of videos designed to give individuals information that they can use to prepare for a visit to a physician's office. The videos are designed to help ensure that the individual can ask appropriate questions of the physician and to increase the likelihood that quality care is delivered. Anxiety. Anxiety is a feeling of fear or imminent danger. Most people experience temporary anxiety in their lives. It is a normal reaction to the stresses of life. But some individuals are constantly anxious, and this interferes with their lives. It can interfere with their daily activities, job performance, schoolwork, and personal relationships. Anxiety disorders can be broken down into different classifications. General anxiety disorder, panic disorder, and phobic disorders. When assessing for general anxiety disorder, physicians are looking for the following: the presence of persistent anxiety and worry about a variety of life experiences. Worry occurs more often than not for at least 6 months and is clearly excessive. The worry is experienced as very challenging to control. The anxiety and worry are accompanied with at least 3 of the following physical or cognitive symptoms. But in children, only 1 symptom is necessary for a diagnosis: edginess or restlessness, tiring easily, more fatigued than usual, impaired concentration or feeling as though the mind goes blank, irritability, which may or may not be observed by others, increased muscle aches or soreness, difficulty sleeping due to trouble falling asleep or staying asleep. The diagnosis is primarily based upon the history, but the physician will want to exclude organic causes, simulating anxiety by history, physical examination, and investigative tests. The physician will want to exclude depression, drug or alcohol dependence or withdrawal, hyperthyroidism, cardiac causes, and any medications prescribed by physicians as the causes simulating anxiety. Once the physician has excluded causes simulating anxiety, he or she can proceed to treatment. The physician will then want to assess whether or not the anxiety is normal anxiety, mild or a simple phobia, or moderate to severe anxiety. Treatment will depend upon the physician's initial diagnosis. Simple, generalized anxiety can be managed with non-pharmacological methods in order to avoid the initial use of drugs if possible. Education and assurance will be given by the physician. Careful explanation of the reasons for the patient's symptoms, reassurance of the absence of organic disease as the cause of the patient's symptoms. The physician will provide practical advice on ways of dealing with the problems. The physician will advise on avoidance of aggravating substances that may contribute to the symptoms, such as nicotine, caffeine, and drugs. And the physician will advise on coping skills and stress management techniques, such as relaxation and exercise programs. In addition to what we just described, when a patient has moderate or severe anxiety, the physician will usually prescribe medications. Medications will usually be given for short periods of time. Another treatment protocol that helps when the patient's initial management has not succeeded may include cognitive behavior therapy. Cognitive behavior therapy is an example of one type of psychotherapy that can help people with anxiety disorders. It teaches people different ways of thinking, behaving, and reacting to anxiety-producing situations. Cognitive behavior therapy can also help people learn and practice social skills, which is vital for treating social anxiety disorder. Medications used for treatment may include, for short acute episodes, physicians use commonly anti-anxiety medications called benzodiazepines, Although benzodiazepines are sometimes used as first-line treatments for generalized anxiety disorder, they do have benefits and drawbacks. Some benefits of benzodiazepines are that they are effective in relieving anxiety and take effect more quickly than antidepressant medications often prescribed for anxiety. Some drawbacks of benzodiazepines are that people can build up a tolerance to them if they are taken for a long period of time, and they may need higher and higher doses to get the same effect. Some people may even become dependent upon them. Diazepam, also called Valium, is often prescribed. A dose of 2 to 5 milligrams twice a day as needed, or diazepam 5 to 10 milligrams once at night may be prescribed. Other benzodiazepines, such as alprazolam, also called Xanax, may also be used. Usually the medication will be prescribed for a short period, up to 2 weeks, then tapered to 0 over the following 4-week period. The physician will always be wary of patients demonstrating a drug-seeking behavior. Now, for long-term treatment, if non-pharmacological treatment is ineffective, then long-term treatment will be an option for chronic anxiety. A different type of anti-anxiety medication is buspirone. Buspirone is a non-benzodiazepine medication specifically indicated for the treatment of chronic anxiety, although it does not help everyone. Dosing is usually 5 milligram tablet 3 times a day. The dose may be increased to 20 to 30 milligrams per day for a total amount by increasing the dosage amount by 5 milligrams per day every 2 to 3 days. The patient's response to buspirone usually takes 7 to 10 days. It does not appear to cause sedation. Buspirone is not recommended for people with renal or hepatic impairment. Well, I think we'll end our initial discussion of anxiety here. In the next video, we will pick up on panic disorders and phobic disorders. Well, I hope this helps. Have a good day.